Hi, I'm Dr. Jan Jaffer, and this is Got Teeth, a patient-centric monthly podcast featuring local health experts. So today I'm talking to Dr. Shaily from Ranchlands Dental Clinic, who's one of our partners at the office. Thanks for joining us.
Thank you. It's a pleasure to be here today.
So it's Oral Health Month, and there's lots of questions that people ask. They ask us, all sorts of different things, and so we're going to talk a little bit about just general oral health, and then get into some stuff that people may or may not know. So let's start really simple. Let's talk about brushing and flossing our teeth. How many times a day should we be doing something like that?
Absolutely. So, Jan, with our patients at Ranchlands, we're encouraging a routine, and that's what we're trying to build is routines with our patients. So bringing in a twice a day brushing routine, and if we can get in there with floss once a day, nighttime especially is the aim that we want to get at.
Okay. Do we floss before we brush? Do we brush before we floss?
I think this is another big area of back and forth that we have, and I think what we recommend with our patients is flossing before brushing. And then once you're able to get in with your toothbrush, you're able to get into those spots where the floss was able to clean out.
Okay. Electric toothbrush versus a manual toothbrush?
Hands down, electric toothbrush all the way. I think you have to try it to know it. We get some really good electric toothbrushes on the market right now. Does the job for you first thing in the morning. And we always tell our patients that brushing is always done at a time when we are the most tired, whether it's first thing in the morning, it's before when we're going to bed. Electric toothbrush all the way, and even children we're starting to encourage about the age of 6 to start using a battery operated toothbrush to help them as well too.
Yeah, that's interesting, and I believe that. I mean, electric toothbrushes make it so much easier, and they also have timers built in, because what we think is 2 minutes is not often 2 minutes, and so my brush will actually give me like a unhappy face if I haven't got quite there, and longer. I mean, for my kids, I had them on electric toothbrushes at 2. Both of them have electric toothbrushes. They have their own. It's a bit fun for them to do it. And again, we're still trying to help them, but ultimately we let them do a little bit on their own. And, just having them have an electric toothbrush makes a difference. I always just say, make sure they're rechargeable. You're not putting batteries in them. So that just makes it a little simpler, and you get a better quality brush that's rechargeable. So let's talk about some of the other issues that people have. I know patients will often come in and they'll be like, hey, my gums are bleeding when I floss, so I stopped flossing. What's going on when people's gums are bleeding?
Absolutely. So, Jan, we get back to the topic of gum disease and what actually this gum disease is. Gum disease, or inflammation in the gums that surrounds the tooth structure, is what we're looking at. So there's certain signs and certain telltale signs that we're looking for when we're doing our examinations. And the first one is bleeding. So patients who are often bleeding when they're flossing are showing an underlying sign of gum disease. Our job at our clinic is to teach our patients how to clean their teeth and how to clean in between the gums to reduce the risk of gingivitis leading to periodontal disease. There's also other telltale signs that a patient may be experiencing gum disease would be bad breath, also known as halitosis. Patients might notice a little bit of swelling in the gums or redness as well too. And then we often see later on that patients' teeth start shifting, moving, have a little bit of wiggle to them, and that often is a good sign too that gum disease is in active play as well.
So I know you mentioned halitosis, bad breath, and we know that can come either kind of from your mouth and some stuff that's happening in your mouth, or also sometimes it's from your gut. So explain to me, what's going on in your mouth that you have bad breath, and what can we then do about it?
Absolutely, John. So I think when you think of bad breath, it all comes from bacteria, right? It's all stemming from bacteria, whether it's in the mouth or whether it's in the gut itself. What we have to think about in the mouth is how do we decrease the bacterial load that is causing this halitosis? We have tongue cleaners that we can use if we feel as if though the bacteria is on the tongue. Also, a routine dental hygiene visit for us will be able to help detect if it's coming from the gums or the bone itself too. And then also the third reason you can have bad breath or halitosis is when it starts in the gut as well too. So that would be continued on with your medical doctor for further consultation.
Yeah, no, that's great. Because again, sometimes you can get it from different people, and you can feel that, and funny enough, for dentists, we know when it's bad breath coming from gums, because we can smell that perio smell, right? And so that is, again, just getting in there and helping taking care of your mouth a little bit better, and getting us to help you, but also really taking care of your teeth at home.
Absolutely.
So really important, and I think the concept of inflammation is something that we hear about a lot, but we don't necessarily know what it means or how to manage it. Inflammation in our body is not good ever anywhere, and so we want to minimize inflammation. And so when people do come in and they see that, gums that are bleeding, or they say my gums are bleeding, our gums are not really resilient almost enough at that point in time. And so
Absolutely.
we almost need to push through the uncomfortableness of the flossing and the brushing to get them to a point where they stop bleeding.
Absolutely. And this is all decreasing the amount of bacteria. So I think we're talking about how do we lower the levels of bacteria in the mouth. I think the inflammation that starts in the mouth, research has shown, travels to the rest of the body, travels to the gut, and even cardiovascular disease up to a point as well too. Research shows that periodontal patients or patients with gum disease are 3 times more at risk of having cardiovascular disease, and this all starts from the inflammation that is in the mouth. So we have to think about what are the ways that we can decrease this? What are the ways that patients are able to do this at home and in our clinics as well too? First and foremost, oral hygiene routine. We want our patients brushing twice a day and flossing, and within that too, using aids that we use as well too. Water picks, air flossers, being able to use rinses at home as well too. Antiseptic rinses are very beneficial in terms of decreasing that bacterial load that causes the inflammation.
And I think with that, we should probably just mention that we want to try to find alcohol-free, rinses. If we're using a mouth rinse, let's just make sure there's no alcohol in there.
Absolutely.
But they are still useful. You don't need to necessarily use them, but if you want to, they can absolutely help cut down that inflammation. How else can we cut down inflammation both in our mouth and technically through the rest of our body? Because our gut and our mouth are actually very closely connected. I mean, the food enters here and ends up right down into our gut. So what other ways are there for us to decrease inflammation?
So one way that we can decrease the amount of inflammation that we have in our mouth is how we actually eat our food and the ways that we consume our sugars throughout the day. It's very hard to get rid of a full sugar diet and be completely sugar-free, but I think this change ultimately falls on lifestyle. So what we like and try to encourage our patients with is decreasing the amount of sugar, but frequency of meals as well too. So it's good to take a good break in between your meals, and frequent snacking also can introduce quite a bit more inflammation as well.
Yeah, and so that's one of the things that we don't often think about, but it's eating sugar obviously not great for our system, but ultimately that's gonna be part of our diet. There's gonna be some level of that. It's how often or how much, and what's more important.
It's definitely how often. So we want to decrease the amount of snacking, decrease the amount of sugar exposure, and ultimately that affects how much acid is produced and decreases our amount of cavities that we can get.
Yeah, and that's great. And some people, what they don't realize is they're like, oh, I'm just having some crackers or something along those lines. Those are complex carbs. I mean, that's just
Absolutely.
sugar, really, at the end of the day, when the way our body breaks it down. So our mouth does start to break this stuff down. How does sugar affect our oral cavity?
Anytime that we have sugars or we're constantly snacking, our teeth are exposed to a more acidic environment. We want to be able to combat that by trying to decrease the amount of snacking we're having throughout the day and decrease the amount of sugar intake as well.
Yeah, and I think that's really important, right? So again, we want to make sure that if we're going to have some sugar, we're going to have the sugar, and we know that our mouth is in an acidic state. And so then drink some water afterwards. Let that kind of clear out. And don't, suck on the candy for 2 hours,
Exactly.
right? Have the candy if you're going to eat it, have the ice cream if you're going to eat it, but then stop, give your mouth a break, because that constant exposure to snacks, that constant exposure to acid will break down our teeth, both for cavities and to wear them down. So, the one thing that I think we'll kind of finish up with a little bit is around the movement of teeth and, maybe touching on grinding and clenching, because we know that our teeth can move. I mean, they're actually surrounded by ligaments, and their ligaments are inside the bone. And so there's movement in our teeth. So some level of movement's normal, but a lot of movement is not normal. And how do we protect our teeth from moving? And how do we protect our teeth from being damaged even at nighttime?
Absolutely, John. So I think the biggest thing when we think about this is we use this scenario explaining to our patients that our teeth are set in foundation, and they're set in foundation held by a ligament into bone. They're covered by gums over top of that. So the constant wear and tear on our teeth, especially at nighttime, can enable bone loss in the areas, leading to teeth that feel mobile and they feel like they have moved. Patients also start to notice this when their teeth feel sensitive to cold and the edges of the teeth start to wear down too. So when we think about this, the night guard at night, also known as splint, can help prevent further wearing and protect the surrounding bone as well too.
Yeah, perfect. So, I mean, I think there's a lot of great information as we look back at it, right? We want to make sure that we're decreasing inflammation in our body. brushing our teeth, flossing our teeth, using some of those adjuncts like a air flosser or water pick.
Absolutely.
You know, making sure that when we're snacking in shorter amounts and you know, decreasing the number of times that our teeth get acid inside them, and then protecting our teeth at night. Because I think it's
Absolutely.
really important that we do all that. So that's great. Thank you for your time. I
Thank
really
you for
appreciate it.
having me.